Hello and welcome. I am Julia with American Frontline Nurses, and today I'm going to show you how to use a blood pressure cuff. I have two different models. This one is a wrist and this one is an arm one. They're both automatic ones, they're not manual. So first I'm going to show you how to do the wrist one. So you want to, these are not as accurate, just so you're aware. The wrist ones are not as accurate, but they're easier to use, especially if you live home alone. This one is battery operated, so you want to make sure that you have fresh batteries inside of it. And change the batteries quite frequently because it will start to give you a false reading. So this one is Velcro and it goes on your wrist. Now don't be alarmed if my blood pressure reads high. It's been a little bit of a nervousness doing this, so it's very possible that my blood pressure could be high. So you just attach this to your wrist and then you want to turn it on. And then I'm going to hit the start button. And you want to hold this about heart level. It's best if you're sitting down at a kitchen table or at a chair, on a chair somewhere in your home. It's going to count up to the top. If it starts to get too tight, hit the power button, stop it, and readjust the cuff, and then start again. And again, don't be alarmed if my blood pressure is high. My blood pressure is normally normal range. However, it could be high today. It's almost done. This is going to measure our systolic and our diastolic and my pulse as well. These can be found on Amazon or any CVS, Walgreens, anywhere you can find like a type of a drugstore. It's going to take it about a minute to completely pump up and go back down. So it's almost done. It's going to give me a reading, and it did not work. So now I'm going to do it again. And like I said, these are not always accurate. So you're actually seeing live that these are not always accurate, but they are easier to use if you're home alone. So again, don't be alarmed if it is high. It's starting to go down. I believe this one was a model that was picked up at Walmart. They're right around $30 depending on the model that you get. And at the bottom of this video, you will see links below. So it gives me a reading. It gives me the systolic over the diastolic and then my heart rate. So that is how you use a wrist blood pressure cuff. Again, these are not as accurate as the other manual ones and the other automatic ones. I like to keep it in the case so I know it's safe and I always know where it's at. Next up, I'm going to show you how to do an arm one. So these are not as easy to use if you live home alone. This one is Bluetooth, and it also, so you can, if you're taking your blood pressure on a regular basis, this one will upload to your phone if you have the app. So this particular one has the cuff, and then it's battery operated, and it also can be plugged into the wall. So again, you want to make sure that you have fresh batteries in it. If you don't have access to fresh batteries, it's recommended that you plug it into the wall so that you get accurate reading. So I'm going to turn it on. And I'm going to put this on my arm. This has, if you can see, it says elbow and shoulder. And then it also has a red line of where to place it. Again, these are not as easy to use when you're home alone. If you have someone to help you, it's better. So I'm going to take the red line, and you want to put it in the crease of your elbow, just above the crease of your elbow. So it may move a little bit on you, but that's okay. As long as it's not too tight, you can just move it to get it into position. And again, it's best if you're doing this sitting down. So now with this one, I'm going to go ahead and I'm going to hit the start button. And as you can see, it's counting up. And again, don't be alarmed if it has a high reading. Because I'm standing up, it's not going to be an accurate reading. This particular machine is more accurate than the wrist one that we just showed you. So but it's a little bit more difficult to use if you're home alone. So it's counting down. It's going to give me the same readings as the wrist one does, so systolic over diastolic with my heart rate. And if it gets too tight, go ahead and turn the power off. So it shows you what it is. So it's 161 over 106. So that's high. Like I said, it's not going to be accurate overnight. And then my heart rate is 97. So that is how to do this. I'm going to take that off. And then make sure you wipe this down with some type of a cleaner. Just don't spray anything on it, but you can use, and with the wrist one as well, you can use like a Lysol wipe or some type of a wipe to make sure that you clean it between uses. I like to keep mine in the container that it came into. That way it's all in one spot and I know it's easy to grab when I need to use it. I also keep the power cord in it, so just in case the batteries go bad and I have backup for power, I can turn that on. And that is how you use a wrist blood pressure cuff or an arm blood pressure cuff. Again, we thank you guys very much for all your continued support for American Frontline Nurses. If you're able to donate, we would like you to go to AmericanFrontlineNurses.com and click the donate button to be able to help us provide free education and help us with our Tuesday and Thursdays Ask an Advocate Zoom calls that we do. Those are all volunteer hours, and also with our Telegram chat that we do. Thank you very much.